Now we're going to practice how to order a sleep study in PowerChart. You will go to Orders, select Add, type in PSG, and select either of these two options. As you can see, the Sleep Lab offers many different types of sleep studies that can be ordered. The most common ones we use are the sleep study that is a standard one, the sleep study with a CPAP titration, the sleep study with a CPAP titration done as a split night study, and the sleep study with the BiPAP titration. This is just a general orientation on how to order sleep studies, but what we typically do is we oftentimes discuss with our sleep physicians beforehand our patient, the indications, and the needs for a sleep study, and decide which one of these sleep studies is better suited for our patient. An example of how to order a standard sleep study will be like this. Just select the study, and it will bring you to this screen. Throughout the sleep study, if hypoxemia occurs, the sleep lab technicians have to initiate supplemental oxygen on your patient. They have a standard way of doing this, which is their standard oxygen protocol. You can either select that one, or depending on your patient's characteristics and needs, you can modify the oxygen initiation protocol. To do that, you will select the second option and type in your specifications here in these yellow boxes. The other way to do it is to select Other and then type in your specifications in this yellow box here. For this tutorial, I'm going to choose Standard O2 protocol. Then you're going to click this round arrow. The same goes for the other sleep studies. For example, if you want to select sleep study with a CPAP titration, it will bring you to this screen. The sleep lab initiates CPAP with a standard protocol that they follow, and this is their protocol. You can either use that protocol or you can modify it, the same way we modify the oxygen protocol. So you select Modify Guidelines and type in your specific recommendations here. Another way to do it will be to select Other and type in your specifications here in the yellow box. After you're done, click the round arrow. The same goes for a sleep study with a CPAP titration split night and a sleep study with a BiPAP titration. After you're done with your selection, you have to specify who is going to receive the results. If you're ordering it, you can type your name and select yourself. Also specify who is the ordering provider. If you're ordering this study for a patient that's outpatient, you can select Routine Study. If it's an urgent study, select Urgent Outpatient, and this typically requires some discussion with the sleep lab. If the patient is hospitalized, you can select Currently Inpatient, and this as well requires conversations with the sleep nurse practitioner or the sleep fellow. Any other specific information or instructions that you want to provide the lab, you can type in here in this white box. You're going to then select the indications for the study. You can select more than one. You're going to specify the primary symptoms of your patient. You can also select more than one, and any special considerations that your patient might have. You're going to select the tonsil size. If it's unknown, you can click Unknown. If there's any adenoidal hypertrophy, you can select it here. Specify if your patient has normal or abnormal baseline oxygen saturations, and if the patient needs a mask desensitization prior to starting the sleep study. After you're done in this screen, you're going to click the green arrow. Click Done. You review your order here, you can edit or change here. For example, inpatient or outpatient, you can select outpatient and you can select routine. Then click sign and sign your order. And this completes the process on how to order a sleep study.